All right, let's take a look at Quebec's broken healthcare system and ways to fix it. Nurses are burning out, leaving the profession at record rates. Would capping the number of patients they're responsible for caring for help? Or would we be better off prioritizing better working conditions? Let's go to Melanie Jade Boulerice, a nurse and owner of the Nomadic Nurse Agency. Melanie, welcome back to the show.
Thank you so much for having me, Elias.
So, is it as simple as ratios there? A patient ratio? Is that the simple fix?
Again, it's working conditions. So what is the difference between ratios and working conditions? Well, ratios is just the amount of patients that you get. But it doesn't mean that, you can have 6 patients, which is the appropriate ratio for non-acute patients. 6 patients on a day or evening shift is appropriate. However, given how heavy these patients are in the sense of care, that changes the ballgame. So, and ratios on different in critical care. For example, in ICU, you can have 1-to-1 or 2-to-2. But I don't think and to increase the ratios on that would be highly, highly dangerous. And I don't think that that's where they're looking from what I see. But they're looking more onto the regular units. But the problem is that on the regular units, the nurses and are having a lot of work to do because the patients are extremely sick. So bending the ratios is not really going to do much because you need to find a way to get staff in, even if we bring down the ratios. Let's say if we even bring down the ratios and we say, we're instead of 6-to-1 for a nurse and 6 patients, it's going to be 4-to-1. Great, but where are you going to find the staff?
Yeah.
We need to still go figure out who's going to take over those 2 other patients.
Yeah, and that's it. I sense a bit of magical thinking here. So on Friday, right, like a dozen organizations, they demanded that Quebec pass a law to impose patient ratios. And I said, well, geez, okay, listen, these organizations, they're demanding it. Sounds okay. But then I said, well, if you don't have the bodies, what does it matter if there's a ratio by law if there's not enough people to work as nurses?
Mm-hmm. Exactly, because the problem is with this is we need to make the profession more appealing. Yes, we can say that putting ratios in is a step, but is it the first step? No, I don't think it's the first step because when I go and I work in the hospital, my ratios for now where I am at is respected, and I try to ensure that it's respected amongst the staff that I work with. But here's the problem. It still doesn't change the acuity and how sick the patients are, because that's a world that not everybody understands. Yes, we understand that we need to put laws and all, but it's not just a law thing. It's a quality thing. We're missing out on the important aspect that we need to provide quality care and seeing what the quality our patients are. So we have to start with not only providing resources for the acute scenarios, we need to also prevent this from getting worse. And this all begins with preventative health care, diet, exercise, taking supplements, making sure that your mental health is in check, because mental health affects the physical health. This is something that we can implement for down the line. And this is where we can make a beautiful synergy with things that are usually not covered on insurance or on RAMQ, like going to see a dietitian. That's not covered on RAMQ. And that's fine, but at least at the end of the day, we need to ensure that we have to prevent our population, because we are getting a bigger population, from getting sick down the line. So there's a lot of aspects. It's not just putting a law and calling it a day.
Mm-hmm. We're with Melanie Jade Boulerice, owner of Nomadic Nurse Agency. So let's take a look at working conditions and how it's playing out. What have you seen with, just retention rates? Has anything, is it stabilized? Or are you still seeing a large number of nurses say, that's it, I'm leaving the profession?
I see a large number of nurses saying, that's it, I'm leaving the profession. I have a lot, and even the private sector in certain scenarios are not always that appealing either. So it's not just the public and the public's problem. Because of how the public sector views the healthcare professionals, the private sector, who are mainly business owners, see that it's not that nurses all will work for cheaper, so we can definitely cut our budget within the nurses. So if you don't have a business owner that has a private sector hospital or private sector clinic of some sort, and they don't understand the value of nurses and realize that we pay a license fee every year to ensure that we're a professional, and they want to cut down the prices. Like I've had this discussion with somebody before. They were like, "Well, why would I pay more? Isn't Quebec nurses cheap?" And I didn't sign with that person. I didn't do business with that person, and it's because that's not where healthcare needs to go. It needs to incline.
Is Melanie, as we wrap up here, is there any part of the healthcare system where you say, you know what, I've got a good story to tell, where you know what, things are improving? Is there any glimmer of hope that you're seeing?
You know what? The nurses that are there, that are still there, take care of them safely, take care of them preciously, because I'm telling you, the nurses that are there that are not giving up, they love their jobs. Mm-hmm. At least they love their job, but don't take it for granted. They absolutely, like the nurses that I sit and I chat with, and I take the time to understand like what they like, what they don't like about their job. Well, when I hear the things that they like, they do love what they do, and it's okay to go see a professional and talk. Yes, they may be tired, but they still love what they do if they're still in it at this point.
Melanie Jade Boulerice is owner of Nomadic Nurse Agency. Thank you so much for coming on the show today.
Thank you so much for having me.